I'm Dr. Amulya from Amulya Labs, and just to let you know, I've done my MBBS from GMC Amritsar and postgraduate from FMC Pune. Thereafter, I served my country for over 20 years, had an academic stint in the United States, and I've headed back to be among my own people. Here I've opened up a laboratory in Sector 104, and while I'm dealing with my clientele and telling them what all problems they have and covering them up for their lab work, I realized that there is very low public awareness amongst our clientele. To this effect, I've decided to carry out a series where I would like to explain certain diseases and how they should be tested, and who should test them, and what you should look for in it. So the first lecture today, I just want to tell you about laboratory medicine and what we do. So laboratory medicine comprises of three fields basically. That is, the courses are basically of MD microbiology, where you grow infectious material and detect the infectious agent. Thereafter, the other field is biochemistry, where blood samples are tested for various biochemical parameters, and histopathology, where we do study tissues as well. So just also I would like to emphasize on the fact, while an MD pathologist can run a laboratory with biochemistry and immunology as well as the microbiology, a sole MD microbiologist and an MD biochemistry cannot study tissue under the microscope. So this must be kept in mind when somebody signs out a report. Check out the qualification of your laboratory doctor. I am saying so because recently I saw a cytology, a pap smear report signed out by an MD microbiologist, which is not correct. In the armed forces, however, we are trained to cover the other fields of laboratory medicine too, because we may be posted to laboratory and we have to cover the entire all three fields of laboratory medicine. But for that we have an extra exam which we call the graded exam. So we are graded specialists, and thereafter, after 5 years, again we are observed and reviewed and called classified specialists. So that's how your doctor from the laboratory should be and what you should look for in his or her qualification. Secondly, the lab should be absolutely hygienic. Your environment for testing should be clean and safe for you. That's something you should keep in mind when you choose a particular laboratory. Thirdly, the laboratory in which you send your samples to should have an internal as well as an external quality control. Internal quality control, basically we run known sample every day before we start testing. We know the value of that sample, and only if the machine gives us a level or a range within that can we proceed with the testing. Otherwise, we have to calibrate the machine. As of today, you cannot do manually all the samples. So all laboratories are automated. This advertisement saying fully automated, fully computerized doesn't mean much as of today in the field of medicine. All of them are automated. Now the problem is you have to know that the result which you're getting from that machine is correct or not. For that you need an internal quality control. Secondly, the laboratory should run an external quality. You should get a sample from outside, from institutions of repute, like we are taking our biochemistry external quality control from CMC Vellore, and our hematology comes from AIIMS New Delhi. So we run those samples and send it to them, and we get our results feedback, and that's how we get to know that we are on the right track. So it's important to know all this, and that's what you should look for. Unfortunately, our clientele, even from the most educated backgrounds, we just want a quick and fast. The faster you give the test report, the better it is for it. Sometimes you think you're just allowing anyone to take a sample and giving you a report just by the time he reaches maybe a mile or two from your place. But that's not it. You need to know your sample is important. It's a precious one, and you may be having some problem which will be detected on testing. And that's what we are here for. So that's what I want to let you know. Third thing I want you to know is the qualification of the lab technician. He has to be properly supervised and do the tests appropriately, especially from time to time. Of course, microscopy is to be done by the pathologist only. This is all very important because laboratory medicine provides the evidence to the treating physician as well as to the patients that he really is suffering from the disease. If you have a raised bilirubin, if you have there's something going wrong with your liver, and then if you have certain viral agents which positive for your maybe hepatitis A or not, so you get to know. Unless that is there, you're just doing guesswork, right? So the clinicians also do need us, and we are always there to serve them, and we want to do the test appropriately, correctly, and behind every sample there is a patient and his problem which we are here to solve. So that's about what we do. And I shall now, in my further series, I shall be discussing about individually about different diseases, what you should test, what the most common ones, of course. So what our clientele, our patients should know about their tests. Thank you. Have a great day.